There is a maternal morbidity rate in the United States right now that is disproportionately affecting Black women. The U.S. maternal morbidity rate is the highest out of all industrialized nations. The CDC, in fact, estimates this year that Black women are 3 times more likely to die from pregnancy-related causes than white and Hispanic women. In the documentary Aftershock, producer and directors Tonya Lee and Paula Eiselt follow the aftermath from the untimely deaths of 2 young Black women, Shamani Gibson and Amber Rose Isaac, who died due to what their families say was medical negligence. Let's take a look.
My daughter's story is loud, colorful, and artful.
It's a girl!
She was awake, aware, and active. And yet she still died.
Tonya and Paula, we thank you so much for joining us in studio. Exciting that Aftershock is now out on Hulu today. So let's just start right off the top, because, you know, a lot of times people are looking at this, and we're going to get into the fact that this is especially impacting Black women. But also in the film, you talk about how this is unusually high in the United States. When we're talking about other countries, they don't see the death rates that we see here. What's the explanation for that?
Well, it's really interesting because in other industrialized nations, midwifery care is integrated into women's care. The United States is the only developed nation that does not have midwifery care integrated into women's health, and their outcomes are better than ours. So if you want to compare us to other nations, I would start there.
And Paula, we see throughout the movie where the family's grief is really turned into activism, right? What can we do to save more lives like Shamani's and Amber's?
Yeah, this is a very solvable crisis. This is something we can fix. As Tonya said, we need more midwives in the system, especially more midwives of color. We also need doula care, which is, you know, a doula is an advocate that can come with a woman to the hospital or any birth setting and help that woman advocate for herself.
And I think that many people had heard the statistics ahead of time, right? But in the movie, you really kind of explain the backstory of why, especially why we see Black women who are 3 times more likely to die from childbirth. So kind of touch on those points a bit for us now.
Yeah, I mean, what we came away from with the film is that often when Black women show up looking for help, because they are looking for help when they're not feeling well, and they say, I don't feel well, they're dismissed. So Black women are not seen, they're not heard when they go looking for their own help. They are as healthy as they can be often, and for some reason, our society just doesn't want to listen to us.
And also you brought up the idea that the Black women disproportionately are often using Medicare or Medicaid, and what does that mean as far as when you go to have a baby?
So a lot of hospital systems, they have 2 separate kinds of care. There's the private patients that have private insurance, and there's the clinic patients. And if you're a clinic patient, you have Medicaid or Medicare, you don't have a consistent doctor necessarily. You have who's there. You don't have a doctor on call for you, whereas if you have a private physician, you have a relationship, you have a rapport. You can build trust. It's very hard when you're seen, when you don't have that consistency.
And often you were talking about the difference in the C-section versus the vaginal birth, right? That the C-section can make more money for the hospital, it's faster, right? And then also you have a lot of the Medicare and Medicaid patients, I suppose, who are getting the teaching, the doctors who are just learning.
Yeah, unfortunately, the most vulnerable people are treated by those that have the least experience because they're really trying to learn. But I also want to say, though, that Black women, this issue of Black maternal health goes across socioeconomic lines. As Black women, we are all really at risk.
And to that point, you know, it's been said that from the beginning, reproductive health was really racist. I mean, how so?
The maternal mortality crisis didn't just pop up out of nowhere. This is part of a historical continuum from 1619 that has devalued and dehumanized Black women. And that started during slavery times when Black women were experimented on. James Marion Sims, who's known as the father of gynecology, did horrific experiments on enslaved Black women. And then that goes to the 20th century where Black midwives were essentially eradicated and white men came and really took over the profession of birthing. We don't have an integrated maternal health system.
Something else that you really focus on is the bond that develops between Bruce and Amari, who obviously both lost their partners and the mothers of their children. And I just want to take a clip from, they'll look at a clip from the Weeksville Heritage Center, where the idea of the support and activism group for Black men was formed. Let's take a look.
I never thought that this would happen to my family.
Yes.
Because I do reproductive justice work. But, you know, just also, why wouldn't it? We're Black and brown. You know, she's a woman, she was having a baby, so why would we think we would be exempt because we have the knowledge? Knowledge doesn't save you from this epidemic.
Some powerful words from Shamani's mom there. What do people need beyond education to really make a change here?
People need to advocate for themselves and be empowered, but I really think it's incumbent on the system to listen and see women, especially Black women, and center them in care. You can choose to birth with a midwife, you can choose a birthing center if you can access one. There are other ways that you can birth, and you have a right to evidence-based care.
Paula, Tonya, congratulations on this baby that you have birthed that we can all take a look at now on Hulu. The powerful documentary Aftershock is available right now.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.